Good morning, I'm Dr. Marianne Gale from New South Wales Health with the COVID-19 update for today, Wednesday, the 24th of November. In New South Wales, in the 24 hours till 8 p.m. last night, there were 248 cases of COVID-19 reported and more than 80,000 COVID-19 tests. Across New South Wales, 94.4% of people aged 16 years and over have received a first dose of a COVID vaccine, and 92% are fully vaccinated. Of people aged 12 to 15, 81% have received a first dose of a COVID vaccine and 75.7% are fully vaccinated. Currently in hospital, there are 195 COVID-19 cases admitted, 35 people in intensive care, 10 of whom require ventilation. Of the people in ICU, 27 people have not been vaccinated, 3 people have received a first dose, and 5 people have received 2 doses of a COVID-19 vaccine. Sadly, New South Wales Health is today reporting the deaths of 2 people. They are a man in his 80s from Western Sydney who died at Nepean Hospital. He was not vaccinated and had some underlying health conditions. The second death we report is a woman in her 60s from the Wollongong area who died at Wollongong Hospital. She had received 1 dose of a COVID-19 vaccine and had underlying health conditions. And on behalf of New South Wales Health, I express my sincere condolences to the families and the friends of those 2 people who've passed away. Some important messages for today. As we know, during this pandemic, it's really up to each and every one of us to take steps to keep ourselves safe, as well as our family and the people around us. We continue to see quite a number of cases of COVID-19 in schools amongst our young people. So we do urge our young people and parents to be particularly vigilant. It's really important that if a child has even the mildest of symptoms, that they don't go to school. Symptoms of COVID, particularly in children, can be mild, so do be extra careful. And if a child is unwell, it's important to get tested and wait for the result before going to school. 12 to 15-year-olds are eligible for vaccination, and there are multiple channels through which vaccination can be accessed. We're really pleased to see the vaccination coverage increasing in that age group, but there are still 12 to 15-year-olds out there who haven't yet had a first dose and haven't yet had a second dose. So please, for families, please encourage and help get your 12 to 15-year-olds to vaccination clinics, and there are multiple options across the state. It's really important as well for people, now that we have rapid antigen testing available, it's really important for us to know that if you do have symptoms, even if mild, the best test to have is still a standard PCR test from a testing clinic. So please, if you do have symptoms, get a PCR test. A rapid antigen test is not that suitable for people with symptoms. So please, if you have symptoms, a PCR test is the best test to get. If you do have a rapid antigen test and it is positive, it's really important to get that confirmed as well with a PCR test at a testing clinic. So please, if you do have symptoms, get tested, and a PCR test is the best test to get. Rapid antigen tests are really important as well as one of our testing options, but if you have symptoms, PCR test is the best test to get. So thank you everybody again for all your efforts to stay safe, protect yourselves, protect your families and community from COVID-19 transmission. Thank you.